Welcome to The Explainer. You know, the modern eye exam is probably one of the most common checkups we get. But do you really know what's going on behind all those crazy charts and machines? Today, we're going to break down what a comprehensive eye examination is really all about.
Yeah, it's about so much more than just figuring out if you need glasses. Seriously. Your eyes are like this unique window into your overall health, and they can reveal clues about everything from your vascular system all the way to your brain. So let's follow the journey of a typical patient and see what's actually being looked at.
Okay, so here's the plan. We'll start with the big picture. What's the point of the whole thing? Then we'll walk through that initial conversation, the physical checkup, dive into the cool high-tech diagnostics, and finally, we'll tie it all together to see how it connects to your overall health.
All right, first things first, what are we even trying to accomplish here? Because I can promise you, it goes way beyond just reading that letter chart on the wall. A truly comprehensive eye exam is designed to check out a whole range of functions.
And you might be surprised just how broad the scope is. I mean, of course, it checks your visual sharpness, that's called acuity, but it also looks at how your eye muscles are working together, the physical structures inside your eye, the pressure within the eyeball itself, and even the health of the neurological pathways that connect your eyes to your brain. It's a lot.
So, where does it all begin? Well, the first part of any great exam doesn't start with a bright light or a fancy machine. Nope, it starts with a simple conversation. This is what we call the subjective assessment, or your personal story really gives the doctor the initial roadmap. They'll ask things like, are you seeing halos around lights, experiencing any double vision? And notice the other questions. They'll ask about things like diabetes, hypertension, and your family history. These answers provide such vital context. Like a family history of glaucoma, that immediately raises a little red flag, and the doctor knows to investigate that more closely.
Okay, next up is what's called the objective assessment. This is where the doctor starts gathering their own data, and it kicks off with a simple visual check that I think we'll all recognize. You know, before any of those charts or lenses even come out, the doctor just looks. They'll inspect your eyelids, the conjunctiva, the sclera, that's the white of your eye, a droopy eyelid, which is called ptosis, or maybe a yellow tint that could point to jaundice. These are immediate visible signs that something might be up.
All right, now let's talk about that famous chart. What it's really measuring is your visual acuity. And all that means is it's a standardized way to put a number on the sharpness and clarity of your vision from a very specific distance.
And the process itself is super straightforward, right? You stand 20 feet away, you cover one eye, and you read the smallest line you can possibly make out. The procedure is simple, sure, but the information it gives us is the absolute fundamental starting point for assessing vision.
So what about those fractions you always hear, like 20/20? They're not just random numbers. 6/6 or 20/20 means you can see clearly at 20 feet what a person with normal vision sees at 20 feet. Simple enough. But let's say your vision is 660. That means you have to be as close as 6 meters to see what someone with normal vision can see from 60 meters away. It's a really clear, quantifiable way to measure just how significant the impairment is.
Okay, from there, the exam gets a little more specific. The refraction test, that's the one with the big machine where they ask which is better, 1 or 2. That's what determines your exact prescription by looking for errors like nearsightedness. And then there's the color vision test, with those classic Ishihara plates full of colored dots. That's screening for color blindness. 2 totally different tests, each looking at a very specific visual function. Have you ever wondered what the doctor is actually checking for when they're shining that little light in your eyes? Well, they're running through a mental checklist called PERLA. They're making sure your pupils are equal, round, and reactive to both light and accommodation. You see, a sluggish or uneven response can be an early sign of a neurological issue, which makes this quick check a surprisingly powerful brain function test.
All right, now we're going to go beyond what we can just see on the surface. It's time to look at the advanced tools that let doctors peer deep inside the eye itself.
The air puff test. A lot of people know that one, right? Well, its clinical name is tonometry, and its whole purpose is to measure the fluid pressure inside your eye. And this isn't just some random check. It's one of the most critical screening tools we have for a very serious vision-threatening disease. The magic number they're looking for is somewhere between 10 and 21 millimeters of mercury. If your pressure is consistently higher than that range, it's a major risk factor for glaucoma. And that's a condition that can cause irreversible blindness by damaging the optic nerve. So, yeah, that little puff of air is pretty important.
Now, there are two key instruments that basically allow for a microscopic tour of your eye. First, you've got the slit lamp. Think of it as a high-powered microscope for looking at the front of the eye, the cornea, the lens, to find things like cataracts. Then there's the ophthalmoscope. That's the tool for looking at the back of the eye, so the doctor can see your retina and optic nerve directly and check for signs of disease. And sometimes you need to bring in the even more advanced imaging. An OCT scan uses light to create this incredibly detailed cross-sectional image of the retina. It's kind of like a CT scan, but for your eye. But what if the view is blocked, like by a really dense cataract? Well, that's when a B-scan ultrasound comes in. It uses sound waves to see what's happening behind the obstruction.
And beyond those main tools, there's a whole bunch of other specialized tests. For example, a little bit of green dye can highlight tiny scratches on your cornea. A visual field test can literally map out your peripheral vision to find blind spots you might not even realize you have. And a simple little paper strip can measure your tear production to diagnose dry eye. Each one of these is designed to answer a very, very specific question about your eye health.
So after all of that, the questions, the charts, the lights, the high-tech scans, what's the big takeaway here? Why does all of this stuff matter so much? This is it. This is the key. The eye gives us a direct, non-invasive look at your circulatory system and your central nervous system. I mean, an ophthalmologist can see your blood vessels and your optic nerve just as they are, in their natural state. It offers this totally unique glimpse into the health of your entire body.
And that glimpse can be incredibly powerful, for real. Tiny little hemorrhages or leaky blood vessels back in the retina, that can be the very first sign of diabetes. Swelling of the optic nerve might indicate a brain tumor. This is exactly why an eye exam isn't just about your eyes. It is a frontline diagnostic tool for some major systemic diseases.
And really, that's the ultimate goal. From that first conversation about your headaches, all the way to that high-resolution OCT scan of your retina, every single piece of data is like a dot. And the doctor's job is to connect all those dots, creating a complete picture to protect not just your sight, but your overall health and well-being. So we'll just leave you with this simple question. It's so much more than just a quick vision screening. It's a vital part of your healthcare. So when was the last time you had a truly comprehensive look?